All eating is emotional eating. It starts with infancy. Eating makes the infant quiet, feel safe, and feel connected to his mother or caretaker. So we all start that way. And every time you eat something, it is an emotional experience of one kind or another. Then you have to begin to ask yourself the question, how much choice do you have after that? And the choice of what you eat and how much you eat is really part of your emancipation as an adult. So emotional eating is basically the conflict between the desire to eat in a healthy way and the emotion which says, if I eat now when I'm feeling bad, I'm going to feel better.
So in your book, you talk about the problem-solving mind. Can you tell us what that means?
The problem-solving mind is that we all, again, as an adults, have to adapt, have to make our life work, and have to make our life better. Every day, we have problems to solve of one kind or another and conflicts to resolve. If you could simply approach those problems and say, okay, what's bothering me? What are my options? What can I do about it? And then just go ahead and do it. You would be taking care of most of the things that are bothering you. They wouldn't take very long, and you'd be on an even keel. Mm-hmm. Life doesn't work that way. It turns out that we have emotions, we have history, we have fears, we have goals, we have all these other things going on in our mind that are interfering. But fear and feeling bad is the one that interferes the most. So it interrupts your problem-solving, healthy way of thinking. And that's where food comes in. Mm-hmm. Because if, in fact, you are bothered by something, and instead of finishing your conversation with yourself and figuring out what you can do about it, you feel so bad along the way, you feel, I have to eat. You actually are shutting off your mind. And besides increasing your weight, it actually is interfering with your personal development.
It leads me to this notion that you talk about in your book, the feeling of powerlessness. And what exactly is that? How do you know when you're there? And then I guess the follow-up to that would be, how can I guard against it?
Powerlessness, I think, in one anecdote can tell you what it's all about. When a patient would come to me and tell me about how much they ate and how angry they are at themselves for eating so much, I would say to them, and they would tell me what happened, I would say, why did you do that? And they would say, what else could I do?
Wow.
So in the midst of an experience of one kind or another, where something is going on, you feel bad, and then if you feel not just bad, but awful, you say, I have to have relief right now, and food is always handy. It's more handy and more available than alcohol. Cigarettes, of course, is another way of doing it, but it makes you feel better. And you stop talking to yourself. You stop your problem solving at that point in time. And then you have to eat. It feels like a compulsion.
So it manifests itself into an addiction.
Well, in the people who are called yo-yo dieting, they diet, they lose weight, then something happens, and they go back to using food for emotional relief. The studies say that every time you do that, you increase your weight about 4 or 5 or 6%. Mm-hmm. So it doesn't work because you go back and forth, and what you're doing is you're taking your conflict between I want to control my weight and I want to use food whenever I want it,
right?
Because I have a craving for it, and you just alternate it in time. So sometimes you're dieting, then sometimes you're eating. Weeks, months, it doesn't work. You're not solving your conflict. The conflict, and that's what the whole program is all about. You can't lose weight and control your weight unless you start out understanding I have a conflict myself.
Yeah.
And that's why in the program, one of the key elements in the beginning is called Zappa craving. And it's related to your incident about one of your tips about changing the radio, changing the pattern.
Yeah.
We do so many things we don't even think about as unconscious patterns, but in fact you can stop and think about them, but you have to take a break and you have to pause. So that changing the radio is a way of pausing from whatever habit they want to break.
Got it.
So
The Zappa craving is basically what we do is we take the person through a conversation with themselves long enough to pause and to say, what's going on right now? And I have a choice between eating and not eating. And once you recognize you have a choice, you're beginning to open the door to what makes me feel so awful.
Got it.
it seems like that's all related to the hunger feeling that you talk about in your book. Is that a feeling one experiences in their belly or in their mind?
It's very hard to decide, but there's some very simple ways of thinking about it. If you eat a meal and you're full, and then you keep on eating when you're not full, it has nothing to do with the hunger in your belly. Okay. If it comes on suddenly, you suddenly have this craving, okay? And I mentioned that a person has an incident in the office, they're feeling hurt and angry about something, they start thinking about when I go home, I'm going to eat. It has nothing to do with the hunger in their stomach, because hunger comes on slowly, and hunger is bearable. And hunger you can think about. Should I eat now? Should I eat later? When I'm a little bit more hungry, it's something that you can monitor. But when you have emotional eating, it becomes like a compulsion, and it becomes actually an obsession, because you think about eating, and then when you eat, you beat yourself up for eating, and then you're preoccupied for the next day before you get your perspective back.
So Shrink Yourself, it's a book, it's an app as well, and the app works in a way that people are guiding themselves and learning how to personally deal with their emotional eating. You find that this is more effective than simply dieting, right?
As far as I'm concerned, if you don't deal with emotional eating, then you can't successfully diet for very long.
Right.
Now, there's a spectrum, and so there's many people, many shades along the spectrum. So I don't want to say that universally, because some people can decide, and I know someone who has done this. They were 45 years old, and he was 60 pounds overweight, and he just decided that not only was it unhealthy, it was not a good model for his son. He became a vegetarian. I saw him many months later. I didn't recognize him. He said, "You don't recognize me, do you?" And I said, he lost 60 pounds. He says, "I've changed my lifestyle. I've decided that was it." In the end, that's how people actually end up breaking almost all addictions. Alcohol is the same thing. Most people who stop drinking, who have significant alcohol problems, one day they made the decision and they stopped. People who smoke 3 packs of cigarette a day can do the same thing. They just decide to stop.
Yeah.
It's what leads up to that, and that's why we've taken the process, and that's what the difference between the app and the book, which is we try to take the same process that I would do in my office with a patient and help, because this is a struggle. If it was easy to do, we wouldn't have the epidemic that we have about obesity. It's a struggle in which you can do piece by piece. You learn, you reflect, and your mind begins to take over, and it shifts your mind to the point where then the decision becomes easy. In the beginning, everybody is ambivalent.
Yeah.
I want to change my eating habits, but I don't want to lose food when I'm feeling awful.
Take us briefly through what the 12-week program is, the steps. How can our viewers get started on this journey?
Each week is a different step. The very first step is that when this module, this little program called Zap a Craving, it's when you have a craving, it engages you in a conversation as if you were talking with me. And the conversation starts out with, Dave, where are you right now? And we give you some menu choices and you choose. In the office. And what are you thinking of doing right now? And sorts that out to the point where you have now put into words. So it's not just a vague feeling. I want to do this. It's very explicit, which engages the top part of your mind, the most intelligent part of your mind, which gives you perspective. That's what we do in psychotherapy. Then say, okay, something must be bothering you. What are you feeling? And if you search for words, we help you with the words, and you put, I'm feeling overwhelmed right now. Good. Overwhelmed about what? And we help you sort that out and say, well, I just had an argument with my wife, and da-da-da-da. Okay. Now you have a choice. Do you want to eat or think? You want to think about this and work on it in the problem-solving mind? Okay. Or do you just want to eat and make it go away and forget about it and let it sit?
But then the reaction is you're going to feel awful about yourself, if I understand it right.
Well, you are. Those are the consequences. Right. But you have a choice point. In other words, we're trying to make use of the fact that you are an intelligent adult person, your life, your choice. And this is exactly the atmosphere that we create in psychotherapy. This is what it's all about. So you learn how to do that several times, and so that the first week is really sorting out how to pause, how to look, how to understand what you're feeling, and that's all. That's all you have to do. Then we take those insights that are from this observation, and we actually put them into your journal for you, so that in between you can just read your journal and it will remind you of what you learned. And every time you do it, we identify the patterns and the difference between this time and last time. So it helps you do what a good psychotherapist would do.
Yeah.
And the next session, next week, is basically you say, okay, why, when something happens and I get in a bad mood, does it escalate and become so awful that I feel I have to eat and I'm powerless? So now we help you explore your mood, and you do that during the next week several times, in different times when it's happening. And the whole value of having it on your phone, you can do it on your laptop, is when you're in a bad mood, you could just open it up and say, I'm feeling so-and-so, and it will take you through a way of thinking about it so you can observe how you do this to yourself, so it's not so mysterious.
Yeah. And so the program then goes on, and the 12-week culminates with what?
In the 12-week, you have learned and practiced everything you need to do piece by piece. And during the course of it, you will be monitoring your own progress with little slider bars about all the different things that you have to remember and do. And at the end of that, you're in a position where you can say, you know what, again, there's a spectrum of people. I've been able to do this in 12 weeks. If you want to go on, you can keep on going on at a reduced rate and keep on using it for as long as you want, because underneath there, we have 360 problem-solving modules to deal with all the most of the common problems in life. These modules are something that just help you sort out and think about what's going on and what you can do about it. And they keep your rational mind trained, so you're training your brain all the time. And since that's what you want to end up with, you want to end up with, despite bad feelings, despite feeling awful, despite letting my mind go crazy on me, I can see that there's something I need to do in my life, and here's the options I have, and I can follow it up. So it becomes a way of, I call it mental hygiene, of staying mentally healthy and growing and moving along the developmental spectrum.
Yeah.